Reaching that time of year when children are getting ready to go back to school and some are transitioning from middle school to high school, this kind of transition can make some children and parents anxious. But the people at the Montefiore School Health Program offer the perfect medical, dental, and community services to aid students and their families. Our next guest has been a social worker with Montefiore for the past 8 years, dedicating her career to working with elementary and middle school children. Cheryl Hurst, welcome.
Thank you.
Can you tell me, what is the transition like between a child moving from middle school to high school?
Absolutely. You know, it can be a difficult transition. Students are often nervous about what high school will be like. They're nervous about getting bullied. They're nervous about their classes. It can be a really challenging time.
As kids, I mean, it's now August. It's about a month back to school. What can they do? What can parents do to help children prepare to get back to school, like mentally, physically? What are the steps that they should be taking?
I think with all age groups, one of the most important things is to start a routine. As summer's winding down, it's important to really make sure that children have a really specific routine, which means getting to bed on time, which means, having an idea of what, you're going to wear the next day, having breakfast in the morning. It's really important to have a routine. There's a saying, tomorrow starts tonight. So that means if school were to be starting tomorrow, tonight, parents should make sure that the kids know what they're going to wear, know what time they're going to get up, and that they're getting enough rest the night before.
I know I mentioned middle school and high school, but can you tell me, do elementary students suffer from anxiety, get anxious about returning to school, children possibly moving to New York, going to a new school in New York City for the first time? What kind of issues do elementary school students deal with?
Absolutely. Elementary school students get nervous just as the older students do too. They're worried about their teacher, they're worried about making friends, they're worried about the homework. They do suffer anxiety as well. What parents can do is really continuously reassure their children about their abilities to do well and their abilities to make friends. If parents are positive, children will definitely start to feel more confident about their transitions.
Are there specific coping exercises, mechanisms, things that you tell some of your patients or students that they can do sort of to make it through the day and to make it through the school year?
Absolutely. One of the things I always tell my students is to remember the times where they felt like they were doing a great job. So for example, if one test they don't do as well as a previous test, to remember that when they did do well, they have the potential to do well again. So for example, if they're making a new friend, it's always good for them to know that they have the ability to continue to make new friends.
Well, the big issue out there is cyberbullying, bullying on Facebook, bullying in various different on various different social media platforms. Can you discuss with me the certain issues? What is cyberbullying and how does it affect, basically, children in middle school and high school? I'm sure children are cyberbullied in elementary school. I wouldn't be surprised now.
Yeah, it is surprising that this is happening younger and younger. So cyberbullying is, the time where the social media sites are used to say mean things, to say, disrespectful things to someone, and it's a constant. It's a way to really, I think, shelter and break up friendships, and it happens more often than parents may be even aware of.
What are the specific tips that not only the student but the parent can take to shield their child from the cyberbullying? A lot of times, I know, especially if someone's new to school, going to school for the first time in fall, they're nervous, and then you have this added pressure with being cyberbullied or the threat of being cyberbullied.
Well, parents definitely should be monitoring all the time their child's use of the internet, text messages, cell phones, all the time. I mean, that might not be the thing that kids really want to hear, that their parents are going to be monitoring it, but it really is for their safety. It's so important for parents to know what sites their kids are on, how often they're on it, and who they're friends with.
So your organization has been working for the last 25 years in providing a service. Can you tell me about your organization and what it does, and where can people find more information?
Well, absolutely. The Montefiore School Health Program has, as you said, been around for many years, and we have one of the largest programs in the nation, which means we have now, I think we're up to about 18 schools where we have comprehensive mental health, medical health, dental health, and community health services inside of public schools. It's a fantastic service for families to get mental health care. They can family therapy, individual therapy. They can get vaccines, physicals, dental care, and also be linked to services within their community. It's a really wonderful program, and families can go online at www.montekids.org and click on the school health program to learn more about it.
If you had to sum it up for a middle school student, a high school student, and an elementary school student, what would you say to them as they prepare to go back to school?
Well, just to really maintain a positive attitude and to remember that they can utilize resources within their school. School can be a tough time for many kids. It's not always a fun place, and if they need support, schools that have mental health and medical clinics are there for their support. They can certainly utilize the resources within the school. There are guidance counselors and other teachers that they need support from. It's a really important time for them to do their best and to feel confident. So if they're using the support that they have, it's an even better recipe for success.
So if a child is interested in taking advantage of the service, or parents, where do they go? Do they go to the school guidance counselor, principal, dean? Who do they?
Any of the above. So schools that have school health clinics in their schools, parents can walk right in and register their child. And sometimes we get parents coming to the parent coordinator, and then the parent coordinator will bring the parent to the clinic. We're very welcoming to our families because we really think it's such an important service. They can sign up themselves. They can get the guidance counselor to come down or help them get registered. All of the above.
Thank you, Cheryl, and we wish all the students returning to school in the fall the best of luck.